Hello, my name is Annalie Martin, and today I will be performing different forms of hygiene on the patient, including a bed bath and oral hygiene. One thing to think about with oral hygiene is you're definitely going to want to make sure that you're observing as you're brushing the patient's teeth. If they are able to, of course, you're going to want to ask them if they would like to do it themselves, because we always want to, motivate the patient to do anything they can themselves. So first thing we're going to do is, of course, walk in, ask them their name and date of birth, and then make sure to verify that on the wristband and scan that into the system. So if the patient would like help, you are going to first lower the bed and have the patient turn on their side, and you're going to want them to be able to hold their head down so that it's easy just a little, so that it's easier for them to spit into the basin. So and you will also, in addition to the basin, you're going to want to have a little cup of water so that they can rinse their mouth. So you're going to want to start at the top, and you will want to brush in a 45-degree angle, and you're going to want to get the full outside of their teeth. You're going to want to get their gums, and you are going to want to make sure you get all the way on the inside as well, just like you would your own teeth. Get the back, very good, and then you're going to want to go to the bottom and make sure you get the inside, the outside, the gums, and and then you will have them, you will give them their water and have them spit into the basin. Or you will, you could also use a type of syringe that will put the water in there so that you can wash their mouth out. And you also will definitely want to get their tongue. And then you can also offer them mouthwash. They also do make little sticks with pads on them that you can dip the mouthwash in to get it around, so you can make sure that their mouth is clean. Okay. And if you're in a situation where the patient is unconscious, you are going to want to make sure that they are in a position where the water is able to flow out so that they don't choke. Okay, so the next thing that we are going to do today is going to be a bed bath. So for the bed bath, you definitely would like to have a bed blanket and an extra towel, and you will want your soap. And what most hospitals are using now are disposable cloths, kind of like a bed in a bed in a bag. They're pre-warmed. If they're not pre-warmed, you'll just microwave them for 20 seconds or whatever the directions say. That was just the one that I had seen that we were using in class. But for this demonstration today, I'm going to use a rag because I don't have that at home. So of course, if the patient can wipe their own face, you would allow them to do that, and make sure to give them enough wipes to be able to do each, one for each eye. So for the eyes, you are going to want to start at the conjunctiva and come out to the rest of the eye. And then you will want to make sure for each eye that you dispose of that cloth. The other eye, dispose of that cloth, and then do the entire face. And make sure that you also do get the ears. And then you will dispose of that cloth. And you can use one side of the cloth and then the other side of the cloth. Let's fix this. This rag's kind of small, so it isn't fitting as well as the ones in class, but okay. And then you're just going to want to make sure that you are cleaning from the area that is like from top to bottom, and always clean what is most soiled to least soiled. So you're going to want to make sure to get all the folds. And when you do the arms, you're going to want to make sure that, so the patient is comfortable, that you do have a rag underneath as you're cleaning. With the legs as well. And for the legs, you will start at the ankle. And I just realized I did mess that up. It's you would go from least soiled to most soiled. So I'm sorry about that. And as you are bathing them, you're going to want to make sure that, you know, just keep an eye on their skin. Look at any coloring, just like you would in the skin assessment. Okay, and it's a little hard to do with the teddy bear, but you are going to want to make sure that whichever area you're not doing, you keep them as covered as possible. So, for example, with the arm, I would just have the arm out, because you want to make that patient as comfortable, and you want to, you know, like, respect their privacy. Okay. Then you would, of course, get the whole stomach. And with every single wipe, you are just going to want to use one side, turn it over, fold it over, use the other side, and then dispose of it. So with every wipe of each side, you will dispose. Okay, so now for the male, when you're wiping their perineal area, you of course are going to want to only have that area exposed, and you will want to ask them if they would like to do it themselves. And if they do, you will give them what they need, and you will give them privacy to do that themselves. If they would like your help, you would start, for the male, you would start at the shaft of the penis. You would start at the tip of the penis, going in a circular motion, and then you would go get rid of that wipe, go to the shaft, going in a downward motion, dispose of that, dispose of that, dispose, and then you would do the testicles, and you want to make sure that you are very, very gentle with that, because that is a very sensitive spot. Okay, and then making sure to get new wipes as needed in that area. So then you would cover the patient up, and after you did the whole front of their body, and also, you know, underneath of their legs, making sure that you got in all their creases, you would have the patient turn over, and you are going to want to wash their back in a circular motion. And it's a little hard to tell because I only have one rag, but you're generally going to want to make sure that you get a new wipe, you know, like at least each body part, and also as needed for the different areas. So you're going to want to clean their back in a circular motion. And then you can assist the patient back up. And also with the female, that is a little bit different. So I will show you that as well while we're in this video, since it's all pretty well related. So, and of course, another thing I forgot to note in that is you are going to want to have gloves for that. So for that, you are going to want to use a wipe to wipe the front, and then you are going to do one side of the labia, and then the other side of the labia, the labia fold, and then you are going to want to do one more across the top, and of course being careful to getting a new wipe each time. So I believe, I'm trying to think if that is it. So yeah, I think that would have covered the bed bath and the oral care. Thank you.